Hello, hello. Welcome and good evening, ladies and gentlemen. Welcome to our Monday show here at the Home Health Contract Show here inside Alternative Healthcare Career Group. This is your host, Bert De Vera, physical therapist. Been a physical therapist since 1998. This is my 23rd year as a PT. I can't believe I'm one of the veterans, as far as being a PT is concerned. So welcome, welcome. If you're joining us live inside the Alternative Healthcare Career Group, please say hi. Um, we got a guest tonight, Blacksika. Did I say your name right? Hello, hello. Thanks for joining us. And if you're joining us from YouTube Live, the channel of Alternative Healthcare Career Group, say hi. And I'd like to welcome you guys tonight. Welcome to 2021, right? Whew, I'm glad 2020 is over. And for those of you who didn't know, I survived 2020 as far as, having COVID for 42 days, bilateral pneumonia, 3 days in the hospital. If you have COVID, then you can relate with me. All right. And for those with friends and families who didn't win the battle against COVID, my condolences. I've had families who didn't make it, and I'm pretty sure it's tough, but I'm pretty sure our families are going to want us to move forward. So 2020 is behind us, guys. It's 2021. I'd like for you guys to think of what you can do here at Alternative Healthcare Career Group. I hope you can learn something from this show. I'd like for you guys to think of what you can do for 2021 to better yourself, become a better person, become a better businessman or businesswoman, and how can you capitalize on your career as a PT, OT, SLP, PTA, OTA. What can you do in the year 2021 to make this year better for you? It's going to be a great year. We have the power to make it a great year. Why? Because we have a choice, right? No matter what you're going through, you always have a choice on how you're going to react, what you can do in every situation, okay? We cannot control what's going to happen to us. We cannot control what's happening in our surroundings, but we can always control how we're going to react, right? So tonight, we have a great topic, guys. Tonight, I'm going to share with you how can you make six figures? How can you make at least 100K in the year 2021 doing one eval a day, okay? And I'm sharing this from a PT perspective, okay? And you can also do this from an OT perspective, all right? So if you just do one eval a day, and if you're not a PT or OT, you can still do this by outsourcing other disciplines, okay? PT, PTA, OT, OTA, or SLP, all right? So we're gonna dive in tonight on how you can make that happen. So if you're asking, Bert, how in the world can you make 100K just doing one eval a day, all right? I want you to tune in because I'm gonna break down the numbers. I'm gonna show you guys how it's done, all right? So if for those of you who are not familiar with home health contracting, you can actually watch the video. These are free videos. There's 4 videos. You can go to rehabpreneur.com/Mike Chua. It's showing at the bottom right now. That's the website, rehabpreneur.com/Mike Chua. You can get the free videos in there. If you want to watch the testimonials of our colleagues who've done this program, you can also see that at the rehabpreneur.com website. You will see videos of my interviews. You will see, Q&As and all that stuff. All right. But for you to get the free videos, there's 4 of them showing the cash flow quadrant. It's showing a case study on how we make money. It's showing how you can do this, as a side hustle if you have a job or you're doing something else. And what are the things or the steps you can do to execute and make it happen. All right, the modules that I offer from module 1 to module 12. Okay, so it's actually Maria. Maria is her name. The Blacksika Brown is FB name. Happy New Year, Maria. Thanks for joining us tonight. Also, I want to thank Mike Chua and Emma Shapiro for making this show happen. And thank you to Jennifer for helping me out. She's in the background. She's a PT herself and helping me out in this show tonight. So guys, if you have any questions, feel free to ask, okay? This is your chance to ask me questions about home health contracting. All right, so we're gonna go ahead and dive in. If you have your pens and your notepads, this is the time to pull them out, and you can learn a lot from what I'm gonna share with you tonight, because I'm gonna just pour out everything tonight. I'm gonna show you guys how I do it, and that way you can have an idea. How can you make 6 figures with just 1 eval a day? All right, here we go. So I'm gonna go ahead and share my screen, and hopefully we can pull up my Keynote application. Let me just open that real quick. There it is. And share screen. All right, application, and boom, here we go. You guys ready? Here we go. So I'm gonna pull up my slides and I'm gonna play it. All right, so how to make at least 100K in 2021 doing 1 eval a day. Okay, with 1 eval a day doing home health contracting. How can you pull that off? Okay, here we go. First, you got to know where the money's coming from, right? Okay, Bert, 100K a year. Who's paying who? Where does the money come from? All right. So with home health contracting, the money has to come from somewhere. All right. Here's the good news. You're not billing Medicare. You're not billing insurance. Okay. So there's no credentialing involved. Write it down. You don't need credentialing. You're not billing Medicare Part B. You're not billing Medicare Part A. All right. No credentialing involved. You don't need to be a part of a network of insurance. Okay. The other good news is you're not even marketing to doctors. The home health agency does that. All right. So where does the money come from? Here's where it's coming from. Medicare and insurance, whatever it is, whoever is the payer, they pay the home health agency. Okay. They pay the home health agency. The home health agency is our client. That's who we do business with. All right. So we bill the home health agency per diem or per visit. Okay. How are we billing, or why are we billing the home health agency? Because our contract is with the agency. Okay. Let's say the contract rate is at $75 per visit. By the way, 75 based on my clients from California to New York, that's the average. In Texas, where I come from, $75 a visit is the average. Of course, we charge more for Oasis start of care. We charge more for resumption of care. And sometimes we get paid extra, maybe 10, 15 bucks more for evals. All right. So let's say the contract rate is at 75. I'm being conservative here. Okay. $75 per visit. Okay. Now you might ask me, okay, wait a minute, Bert, $75 per visit contract. Are you saying that since we don't bill Medicare and insurance, we're basically billing the agency based on the contract that they sign with us? Exactly. That's what I'm saying. Your contract is business to business. So once you have your own company, you're going to sign a contract with your company name and the agency name, and then you both signed a contract. Based on this contract, this is what we're going to charge you. Okay. Now, the other question I get is this: how is this different from a travel staffing company? They're kind of similar, but here's the difference. With a travel staffing company, if you've done travel, work before, usually they require a 13-week contract minimum, or 3 months. This is why they send therapists here and there for 3 months. And they have a minimum of 13 weeks, meaning most of them need to get paid for 13 weeks with or without certain number of patients or visits. That's how they make money. So if you're the home health agency and you're hiring someone from travel agency, your cost is going to be higher. Okay. It costs higher. You pay more for a travel agency to send you a therapist as opposed to a contract company like us. That's where the big difference is. With a contract company like we do, guys, we're pretty much local. We're like a staffing company, but we provide locally. In other words, the home health agency only pays us whenever they send us a referral. So when they send us a referral, guess what? They only pay us for the visits that we do. In other words, they are not tied up in, they're not required to pay us 13 weeks. Okay? So they would rather do business with us than a travel agency company because they save money. They pay as they go. They only pay us when we see patients for them. Does that make sense? So similarity, we're both staffing company, the travel agency 13 weeks, us, we don't charge 13 weeks. We're local, all right? And because we're local, most of the time, home health agencies would rather deal with a local therapist. That way they kind of enhance or support local business, all right? And they know since you're local, then you probably have more network, more therapists in your team because you know therapists in your area. Okay, so going back, where does the money come from? So let's say you've established a contract rate of $75 per visit, right? We pay the PTA, OTA $45, okay? This is based on their experience. Usually 45 is the cap, but if they go out of town, it can go 50, 55. However, our rates also go up. It can go 85 or 90, okay? Now, based on this example, if we charge 75, we pay the PTA, OTA 45, the profit from PTA and OTA is at $30 per visit. You follow so far? Okay, $30 per visit is our profit, okay? Now, okay, the math. Before I show you the math, let me go back. Now you might ask me, okay, Bert, why are we charging 75 even if the PTA or OTA does the visit? Okay. Most questions I get is, are we not gonna get paid a lesser amount if the PTA or OTA does the visit? The answer is no. Our contract says $75 per visit, regardless whether it's PT, PTA, OT, OTA, all right, or even SLP. SLP, we probably charge even higher because they're a little bit more expensive, maybe 85 or 90. So with a contract signed, the agency knows, the home health agency knows that that's how we make money, okay? We make money when we send PTA and OTAs. Otherwise, if you don't use PTAs and OTAs, you're not gonna make money. You know why? Because we also pay the evaluating PT, the evaluating OT, we pay them about the same rate, about 75 or even 80 per visit. We break even on the PT and OT supervisors because we're banking on making money on the PTA and OTA. Now, if you ask me, I actually got this question today when I had a call. They asked me, hey, Bert, are they not going to reimburse the PTA or OTA a smaller amount of money? Not with home health. Okay, you're probably thinking of outpatient part B, that's the change is about to come pretty soon, but not with home health. With home health, the way it works right now, every home health agency gets paid a lump sum amount of money based on the diagnosis of the patient. So for example, you have one total knee patient, and this is just an example. Let's say the budget for a total knee is $5,000, okay? The agency gets paid $5,000 and Medicare says, okay, here's $5,000, budget it, okay? However many nursing visits, however many therapy visits, this is the budget, okay? So if the home health agency, for example, hires a nurse for $150 to do this starter care, and then hires a therapy group to do the visits, let's say for 20 visits, okay? After 20 visits and after the nurse visit and their costs, for example, is $1,500. So $5,000 of budget minus $1,500, the home health agency makes $3,500. So it's not bad. It's good money. All right. So it's really good money. Okay. So that's how they make money. And this is why it's not based on getting reimbursed per discipline. Home health is totally different from outpatient. All right. So now that you know where the money is coming from, let's do the math. All right. How in the world can you make 100K in 1 year, 2021, doing just one eval a day? Here we go. Okay, here's the math. Keep taking notes, guys, because this is really, really mind-blowing. All right. So if you do one eval a day, so that's 5 days a week. That means you can do 5 evals a week. How many weeks are there in 1 year? 52 weeks, right? So 5 evals or 1 eval a day times 52 weeks, you're looking at 260 evals a year. Okay, pay attention. 260 evals a year, 1 eval a day. Now, if you do 260 evals at $75, the money it's going to bring in is $19,500 in 1 year. Okay. Now, if you're doing 260 evals, obviously, you're also going to do 260 discharges, right? When there's an eval, there's a discharge. All right. So if you do 260 discharges, 260 DCs, that's 75. That's another $19,500, right? Okay. Here's where the profit is coming in. 260 referrals times 6 PTA visits. Okay, Bert, where's that 6 PTA visits coming from? Let's say the minimum frequency is 2 times a week for 4 weeks. 2 times a week for 4 weeks, that's 8 visits, right? Since you're doing 2 out of the 8 visits, eval and discharge, there's 6 visits in between that you're going to delegate to the PTA. That's where the 6 PTA visits coming from. So 260 referrals times 6 PTA visits, you're looking at 1,560 visits from the PTA. Follow so far? Okay. 1,560 visits from the PTA, multiply that by 30 bucks. Remember, we charge 75, we pay them 45, we make 30 per PTA visit. Okay. The profit for 1 referral a day in 1 year is $46,800 just from the PT side, just from the PTA side. Okay. All right. So you add this all together, you add all these 3, and you get 85,800. All right. 85,800 is what you get when you add this. Okay. Jenny, can you still see me? Can you still see the screen? For some reason, it stopped. Hold on. Let me share that again. Okay, guys, some technical difficulty here. Hold on. Okay, I'm gonna share the screen again. Share screen, application. Sorry, guys. We're therapists, we're problem solvers. We're gonna solve this. Here we go. All right, there it is. All right, play again. Okay. So are we good? Jenny, can you see this screen again? Okay, we're good on the screen. Okay, good. All right, so going back on the math, so 85,800 is the total for this one, right? Now, I told you 6 figures. We're not in 6 figures yet. We're only at 85,800, okay? So we're gonna keep continuing, okay? I'm gonna show you the math again. On the next page, let's say out of the 5 referrals that you get a week, 1 referral or 1 eval a day, let's say 2 of those require OT, okay? It happens. Let's say you have a patient with stroke or a patient with, ADL difficulty, then they will refer, they will order OT. So let's say 2 a week out of those 5 referrals have OT orders, all right? So 2 a week times 52 weeks, now you have 104 OT referrals or OT evals, okay? 104 OT referrals, let's say you have 6 OTA visits or COTA visits, you're looking at 624 visits, okay? 624 visits from the quota, you multiply that by 30 bucks, okay? You have $18,720 profit, okay? Add this to the 85,800, then your total is $104,520. Guys, you reach 6 figures, okay? With just one eval a day that you're doing if you're a PT. And obviously, if you're an OT, you can outsource the PT side, all right? That's how I make at least 6 figures a year with one eval a day, all right? Okay, so with that said, how can you start this as a side hustle, okay? Before I go back to this slide, I think we got some questions. I'm gonna look at those questions. I'm gonna exit here real quick. Okay. All right. We got questions, right? First question, when you're doing these contract visits, do you tell the patient you're from the home health company or your own company? All right, good question. When you do the visits, you tell the patient that you are from the company you have a contract with. Why? Because you are representing that company. Okay, you're basically the therapist of that company. Okay, and then the next question is, do you find that PTA will accept that rate? Hell yeah. Okay, for a 2-year degree at $45 a visit within the city, that's a very good rate. Okay, I tell you what, there's a lot of PTAs and quotas right now with no work. A lot of us are been furloughed, laid off. Okay, if you're a PTA, you're going to complain about $45 a visit within the city limits. I don't know what else is good for you. All right, I tell you, my PTAs are happy at getting paid at $45 a visit. Okay, for a 30-minute work, for a 30-minute treatment session. Of course, we don't just stick to 30 minutes. If the patient needs more than 30 minutes, we do what the patient needs. Okay, now, if you know of a PTA that's getting paid more than $45 per visit, that's totally up to you as a business owner whether you're willing to pay more than that. But to me, that's fair. All right. Now, of course, if a PTA goes out of town, we pay extra to compensate for the travel, but we also charge the agency extra. All right. If you have a PTA that doesn't want to take 45 per visit, forget that PTA. Find somebody else. Somebody will take that offer. I guarantee you. All right. Right now, we are not in a position to demand high prices or high fees and all that because of all the changes that's happening. All right. There's been changes in the nursing home. There's a changes about to happen in outpatient. There's changes also with the home health setting. Guys, if you're complaining about this rate, totally up to you. All right. Next question. How do you find agency that would refer that volume? Okay. That's a very good question. There's ways to find agencies, to refer patients to you based on your contract. Okay. I always get this question, Bert, are there enough patients? Are there enough referrals that are going to come in? All right. You can Google this. There's about 10,000 baby boomers every day. Every day. You can Google this. 10,000 baby boomers every single day. Okay. With or without COVID, they need our services as therapists. Okay. Who do you think is going to do the rehab for total knees, total hips, fracture, amputation, stroke, okay, Parkinson's, multiple sclerosis, post-surgery, post-cabbage, post-hospitalization, debility? Who do you think is going to do the rehab? Nurses? I don't think so. Home health aide? I don't think so. Nothing against them. They're colleagues. Okay, they're part of the rehab team or part of the healthcare team, but it's the therapist. We still do it. All right. Okay, cool. Okay, there's one that says 45 visits was more than what I made at my first OTR job. If you're an OT, of course. Oh, he says more than. Okay. All right, another question. This is from Shannon Resco. Do you cover your own liability or do you fall under the home health company that contracts with you? Guys, keep the questions coming. These are very good questions. We cover our own liability insurance. Each therapist that works for me, they have their own professional liability. And even if you're not in the home care setting, guys, I encourage you to have your own professional liability. Why? Listen up. Case in point, there was a true case that happened in a nursing home where the patient fell, broke her hip, and the family sued the nursing home. Nursing home lost, family won, they got their award, right? Guess what the nursing home did? They turned around, sued the therapist. Okay, they sued the therapist that caused the damage. If you don't have a professional liability insurance, you don't want to be in that situation. Lawyers are expensive. Okay, it only costs about $150 to $200 a year to get a professional liability insurance. You can spend that amount in 2 outings or 2 dinners, okay, or shopping, all right, or a pair of shoes. Guys, do not neglect not getting a professional liability insurance. You need that. If you don't have it, you're exposing yourself, to situations like that. When you get sued, you don't have any coverage, you'll be in deep trouble. All right? Okay, cool. Any more questions? All right, no more questions. Okay, so I hope you guys are getting a lot of value from all these questions I'm answering and all the tips I'm giving you tonight. Guys, if you don't know that this business exists, I'm telling you now, it does. The reason you have not heard of home health contracting business model is because it's not a common practice, okay? Most practices you see out there are outpatient, brick and mortar, okay, where you have a clinic, you lease equipment, you have a receptionist, you market to doctors, you bill Medicare, you bill insurance. Another business model, cash base, okay? You go out there and you find clients that pay you cash, okay? Another model is telehealth, okay, or women's health. There's nothing wrong with these models. If these models work for you, good. I want you to make money. However, you have to ask yourself, who is doing the work? If only you and only you does all the work and you don't have the power or leverage to delegate the work to another therapist, I don't call that a business. In my opinion, that's a job. I don't care if you're getting paid cash. I don't care if you're billing Medicare. I don't care if you're billing insurance. If your business is dependent on you and you cannot delegate the task to someone else and continue to bring in money, should you decide to work or should you decide not to work, to me, that's not a business. That's a job. You just change the payer. Whoever the payer is, insurance, cash, whatever it is, if you are doing the job yourself, if your business is dependent on you doing all the work, that's not a business. That's a job. Okay? If you have the power to make money and the power to delegate the task, should you decide not to work, to me, that is the essence of having a business. A business is when you have others, other people working with you or for you. All right? Okay. So another question, I'll answer this one before we go on a short break. As business owner, do I need both liability insurance for myself and the contract agency as well that I run? Very good question. Okay. So there's 2 types of insurance: professional liability for yourself as a therapist, and the contract agency that you run. It's probably you're probably pertaining to a business insurance, a business liability insurance. It totally depends. Okay, it depends on the contract agency you're working with. Okay? Some agencies will require you to have a business insurance. But here's what I tell them. Look, business insurance usually covers when something happens within the premises of your business location. For example, you have a clinic. Somebody slips or somebody trips in your clinic. They fell, they broke a bone. Guess who's liable? You, as the owner of the clinic, because that's your clinic. However, we are in home health. We don't have a clinic. We go to patient's home, okay? If something happens to the patient at the patient's home, what type of insurance do you think kicks in? Your professional liability insurance. For negligence or malpractice, professional liability insurance will kick in, okay? Because we are the patient's home. Now, for whatever reason, let's say you pulled into a patient's home and you're about to leave, but instead of going reverse, you hit on gas, you put your car into drive, and you hit the corner of the house and you damage the patient's home. What insurance do you think is gonna take in effect? It's your auto insurance, your car insurance. It's called, what is it called? Property damage. It's what it's called, okay? If you have a therapist that's going into a patient's home, they got into an accident, okay? What do you think is gonna come into play? Again, car insurance, what do you call that? Bodily harm, okay? It's the coverage for bodily harm or whoever is at fault during the accident, whether it's the other party, on the collision. So where does the business insurance come in? I don't see it. I don't see where the business insurance is gonna come in. You see what I'm saying? So this is how I explain it to the home health agencies. If they still insist for you to have a business liability insurance, despite explaining your professional liability and your car insurance, then you have to make a decision whether to move forward with the agency or not. Because to me, it's redundant. It will never come, into play as far as I'm concerned. And I've been doing this for 17 years now. Since 2003, I've never have to use a business insurance in the home care setting. Okay. So another comment, so most likely personal liability insurance should be sufficient. Yes, my answer is yes, and that's my own opinion, okay? But then you have to make your own decision as the owner of your company. Okay, so we're gonna go into a short break, and don't go anywhere. Guys, stay with us, because after a short break, you're gonna see how you can execute this as a side hustle. I'm going to give you the 5 major moving parts of a home health contract business. And keep taking down notes, because these are value bombs. These are, special topic tonight. I'm going to show you how you can do this with the 5 major moving parts. So we're going to go on a short break, and we'll see you in a minute.
HelloNote is a truly therapist-friendly practice management solution with integrated EMR that will enhance workflow, efficiency, and patient care. HelloNote reduces error and allows you to spend more time with your patients. It comes integrated with billing. Claims are generated once a note is completed. You can bill with one click and a patient portal, which streamlines the patient intake process. Beautifully engineered and cloud-based for easy accessibility, the software works on all platforms. You can access patient records from anywhere. We also offer 24/7 support. HelloNote is the practice management solution that you're looking for.
All right, we are back, guys. So we are now moving into the topic where you can, or how can you start this as a side hustle. So I'm going to go ahead and share the screen again. So Jen, let me know if you can see it. Here we go. Holding it up now. Share screen. And boom. Okay, Jen, can you see it? I think we can see it. Yeah? Okay. Okay, great. So let me pull that up and click play. Where is it? There you go. Okay, here we go, guys. Keep taking down notes. How can you start this as a side hustle? Okay, there's 5 major moving parts. Make sure my microphone is working. Yeah, I think it's working. Okay. Okay, step number 1. You got to set up your own contract company. All right. Why? Because if you do this as an individual PRN, you cannot delegate the task to any of your staff. Having your own contract company like an LLC or S Corp gives you the ability to set this up as a B2B. B2B is a short abbreviation for business to business. Okay, B2B, business to business. So you're doing business, with a home health agency as another business entity. That's step number 1. Step number 2, you got to gather your crew. Gather your PT, PTA, OT, OTA, and SLP crew. Without a crew, if you're by yourself, then basically you're limiting yourself to what you can do. Okay? You cannot do this on your own. You have to have a crew. All right? Step number 3, establish contracts with home health agencies. Okay? No contract, no business. It's as simple as that. Okay? And I'll show you in a little bit, how can you learn to get contracts. I'll show you in a little bit where I teach that in the modules that I teach my mentees. Okay? Establish contracts with home health agencies. Step number 4, you got to bill for your services, obviously. If you don't bill for your services, then how are you going to get paid? Which brings us to step number 5, get paid, pay your staff, keep the profit, do it again. Okay? Do it again. Rinse and repeat. Okay? So it's as simple as that. It's not a rocket science. However, there's a lot of little teeny bitty moving parts in the background. And that's what I teach the colleagues that are into my program. Okay? All right. So what is this program? Okay, Bert. So you're talking about your home health contracting program. What happens in your program? What do you teach therapists like me if I want to do this, if I want you to mentor me? Okay, so I get these questions a lot. Okay, Bert, if you're going to mentor me, what am I going to learn? So there's 4 weeks in my program. On the first week, you're going to learn on module 1 how to set up your company. Okay, there's a proper way to set up your company. Module 2, how do you hire staff and where to find it? It's a common question. Hey, Bert, where do I find my staff? Where do I find my PT, PTA? Okay, and what if I can't find anyone in my area? What do I do? Okay, that answers your question. Module 3, how do you get contracts with the home health agencies? Okay, there's a way to find the home health agencies in your area. There's also a way to figure out or look into their ratings. So home health agencies are rated, I think, 4 or 5 stars. So you're gonna want to work with agencies with at least, half of that rating, either 2.5 or 3 stars. If they only have 1 star, don't even bother. Okay, and I teach you where to look for this. You can find out at a click of a button where these agencies are and what their ratings are. Okay. Now on the second week, let's say you do 3 modules a week. On the second week, you can start learning about how to establish contract with your PRN therapy staff. Keyword, PRN. I don't have any full-time employees. Therefore, I don't pay benefits. I don't pay, vacation, none of that. They're all PRN, okay? So if they're PRN, I only pay what they do for me. Therefore, I can sleep well at night. If I pay someone, that means they did some work for me. That means money is also coming in, all right? Module 5, how do you bill for your services? So in this module, you're gonna see, like you're on my shoulder, I'm gonna show you step by step, how do we bill for our services? How do we do our invoice online? Everything is online, therefore you can run your business anywhere you are. I run my business from my phone, all right? As long as you have internet, you can make it happen. And module 6, how do you get paid? Okay, if you don't get paid as a business, you're not gonna survive, obviously. Cash flow is king, and that's true. I teach you how to make sure you get paid. Show me the money, all right? You're not supposed to, you're not supposed to be in a position as if you're begging for your money. You have the right to get your money as a company when you've done the services. And you have to be coming from that position. Okay? You're not supposed to be shy in asking for your money. I made that mistake when I was starting back in 03, you know, new business, startup. You're like afraid to ask for your money, but no. If you do that, they're going to take advantage of you. All right? So I teach you how to avoid that. Okay, on the 3rd and 4th week, Module 7, how do you pay your staff from your smartphone? I can do my payroll in less than 10 minutes, guys. Anywhere I am, either whether I'm traveling or anywhere, in less than 10 minutes, I can pay someone direct deposit. Okay? How do you run your daily operations from your phone? So since everything is web-based, with the software that the agency uses, you can actually see what therapist sees what patient. Okay? Once you log in, obviously you have an access. Then if the agency asks you, hey, Bert, we need this eval, we need this patient to be seen, then you have that access. All right? Or your secretary if you don't want to do it yourself. All right? Module 9, how do you start without a business loan? Very, very important. Guys, if you start an outpatient through a franchise company, I've seen a franchise company that charges $52,000 just for a franchise fee, and they take 6% of royalty every month. All right, that's a lot of money. With this business model, you don't spend that amount of money. Okay, you can schedule a call with me. I can talk to you, and if you're a good fit, I will discuss with you how much money you need for this startup. You don't need that much. Okay, to give you an idea, if you have a student loan of $100,000, if you have a student loan of $200,000, let's say $100,000 is your student loan, you're not going to spend not even 10% of your $100,000 loan, student loan, to do this business. Okay, that already gave you a ballpark, not even 10%. All right. Now, module 10, how do you hire a part-time virtual secretary? You need a secretary later on because you don't want to be doing office work. Okay, a $10 job should be given to a person who can do a $10 job. You make more money seeing a patient for 30 minutes for $75 as opposed to doing an office work for $10. Okay, you have to have the mind of an entrepreneur. If you make $75 in 30 minutes, you pay someone $10 an hour to help you in your office work, you still come out on top at 65 bucks. Does that make sense? Yep. Okay. Module 11. I'll show you how do you fill out parts of the contract. The contract that we use, guys, is specific to this business. This is not a contract you buy from LegalZoom for 50 bucks and that's it. This is specific to this business. It covers every single aspect of this business. Okay, what happens when agency asks for this? What happens when they give you a referral? What happens when the notes are due? What happens when are you supposed to get paid? What happens if they don't pay you? How much is this? How much is that? What happens if there's an in-service? Who's going to pay you? Orientation, stuff like that. This is a very elaborate contract. It was done by a lawyer. I hired lawyers to do this contract specific for this business. And they're not cheap. Lawyers can run anywhere from 200 to 300 bucks an hour. All right? They're not cheap. So I will teach you how to fill out parts of the contract. And that contract template is actually part of my bonus. I will show you in a little bit what I mean by that. And lastly, module 12, how do you automate your business process? Meaning what happens from the time you get a referral to the time you discharge the patient. Okay? So real quick, this is going to blow your mind, guys. I'm going to show you what happens from the time we get a referral to the time we discharge. Okay? And I want you to picture, where am I in this picture? Where am I in this scenario? Okay? So here's what happens. These are daily operations. We have a contract with an agency. They call us, or they call my secretary. Hey, Miss Secretary, we have a referral, a total knee in this zip code. Can you guys do it? So my secretary will say, well, let me check to make sure my therapist is available in that zip code, and I'll get back to you in a little bit. Boom. Secretary calls one of my PTs and say, okay, we have a total knee in your area. Can you do it? PT says, yes, I'll do the eval. Next thing that my secretary will do, call the PTA. Hey, so-and-so will do the eval. Can you do follow-up? Can you do the follow-up treatments? PTA says, yes, okay, we'll do it. Secretary turns around, tells the agency, yes, we'll take it. All right, who's the therapist? My secretary will now tell the agency, assign it to this PT, assign it to this PTA. Boom. Everything is web-based. Now the PTA logs in, or the PT logs in, sees the patient on his profile, on his schedule, does the eval, and then after his eval, PTA sees the evaluation, does the visits. Follow so far? All right. Now, once the visits are done, my secretary now will log in or get the report on what visits were done. She goes online, does the invoice. Okay, the invoice, let's say $75 eval, $75 PTA visit. Boom, boom, boom. That's the invoice. Invoice now goes automatically to the agency. Okay, we have already set up who gets the invoice from the agency, and I teach that in my modules. When that person gets the invoice, guess what? It goes to AP. AP is accounts payables. Accounts payables now will issue a check or pay you a direct deposit based on their system. Once you get the payment, it goes to your bank if it's direct deposit, or your secretary deposits the check to your bank. Okay? Now, the money is in your bank now, in your business account. What happens next? When it comes payday, every 2 weeks, I pay my staff from my phone in less than 10 minutes. Boom, direct deposit, they get it. Guess what? I pay them, and the profit stays or remains in my bank, right? And then by the time we discharge the patient, we're done. We keep getting referrals and do it again. Where am I in that picture? Where am I? I'm nowhere in that picture. Basically, the only thing I did was pay them for less than 10 minutes from my phone because I control the money going out. But as far as money going in, they can deposit that directly, or my secretary can deposit the check if we get a check. You see how this works? You can remove yourself from the equation with this business model, okay? And this is why whenever I have mentees, whenever I accept someone in my program to do this model, I expect you to be open for business in 4 weeks as much as possible, okay? You should be open by the 4th week. If you're not open in 4 weeks, that's because you're slacking off, you're goofing off, you're taking your time. That's on you, okay? But guys, if you've seen my interview with Ryan Borgs from Louisiana, this guy is the current record holder. In 30 days, he got it done. He has his contract, he has his crew, he has his visits done in 30 days. If it can be done by someone, you can do it, okay? So it's a question now of are you wanting to do this or not? Are you going to be a worker or a business owner? That's the next question. All right. Let me explain further that topic, worker versus business owner. But before I go there, I want you to hopefully understand how this process works by watching those 4 videos and at least watch how we make money and then ask me questions. Okay, you can always reach me. Okay, how can you reach me? Before I give you my contact info, I just want to let you know that when you get into my program, you get the contract templates. I give you the actual contract templates that we use, done by a lawyer, plus all the forms you need. Okay, what forms are those? Job application form, drug test consent form, background consent form, credential list, even the interview questions. Bert, what am I going to ask when I interview someone that wants to work for me? I give you that. Even the payroll spreadsheet. The payroll spreadsheet is an Excel spreadsheet that tells you who do you pay every 2 weeks, what are you paying? That way, you always know ahead of time, you know, what amount of money is going out. And my secretary usually prepares that for me before the payroll day. Okay, so how can you get in touch with me and how can you ask me questions? You can book a free call with me at speaktobert.com. It'll show you my schedule. Speaktobert.com will show you my calendar, and it's a free call. It's a free call. You can talk to me for about 15 minutes. I will interview you, ask you questions if this is something that fits you. And I say that because not everybody's cut out for this. Okay, if you want to take action, if you want to have your own business, and this is something you want to do, and you're cut out for it, I'll help you. But if you're not cut out for it, I'll tell you up front. Okay, what do I mean by someone that's not cut out for this? Okay, if you're wishy-washy and you can't decide, then I can't help you, because number one thing you need to do is to decide. You have to decide whether you want to be a worker or a business owner. All right, let me stop sharing my screen and I'll elaborate on that. Okay, can you guys see me? Jen, we're still good? Sound and everything? Yep. Okay, all good. All right, guys, I ask this a lot whenever I talk to someone over the phone. Do you want to be a worker or a business owner? Okay, you only have one choice. There's no in between. Okay, it's either you do or you don't. There is no try. That's from Yoda, Star Trek, right? So, okay, it's either you do or you don't. Either you want to be a worker or a business owner. What's the difference? If you're a worker, let's say you're doing PRN here and there, you're working for someone, there's nothing wrong with that if that's what you want to do. However, as a worker, you are always at the mercy of your employer. Meaning you're waiting for a job, you're waiting for work. Okay? You're happy if you're given work. As a business owner, the big difference is you go out. We go out and hunt. We make things happen. We find our own crew. We get contracts. We market. We talk to agencies. We make things happen. We go out and hunt. Okay? We don't wait for someone to throw us a bone. We go out there and drag something home. Okay? That's a business owner. We look for something that will provide us leverage. Okay? How can I produce, for example, if last week I talked about, how can you cover, let's say, $3,000 a month if those are your monthly expenses? How can you produce $3,000 a month to cover your monthly expenses doing business? Okay? You have to ask that question. How can I produce $3,000 a month without me doing all the work? Okay? Guys, this is a model that you can do, okay, in conjunction with other business models. If you want to do cash-based, Part B, telehealth, you can do this in addition to that business. I'm not saying throw all those business models and just do this alone. I'm saying you got to diversify. You got to have multiple streams of income. If you ask me, yes, I'm biased. I want a business that gives me the ability to see patients when I want to, not because I have to. Okay? As a business owner, I have the freedom to see patients if I want to. Let's say we get a referral that's ortho. I like ortho. You know what? I'll keep seeing these patients. Okay? I have that freedom. However, if I don't have the freedom to delegate that, because I'm the sole worker, I'm the only therapist, guess what? When you want to spend time with your family, you want to spend time with your kid or your significant other, you're tied up. You can't do anything. You have to see the patient. Okay? And when you stop seeing the patient, there's no money coming in. That's not a good business. Okay? You have to have a business that makes you money even if you decide not to see the patient. All right, guys? Hopefully this is making sense to you guys. All right? If you want to see the videos on how this works, you can go to rehabpreneur.com/Mike Chua. Okay? It's streaming at the bottom. Okay, rehabpreneur.com/Mike Chua, and you will see the 4 videos on how this business model works in depth. Okay? So you got to decide. Do you want to be a business owner or you want to be a worker? Okay? Totally up to you. Okay, there's one more question before we wrap this up. Is your crew comprised of employees or independent contractors? Okay? Very good question. So guys, the answer to that is it depends on what state you're in. Okay? Some states are independent contractor friendly. Some states are not independent contractor friendly. However, it should not be, a hindering factor. Let me tell you why. You can always adjust the payment. You can always adjust the fees you're going to pay based on whether you have employees or independent contractors. What do I mean by that? Okay? I used to have both. But then my CPA told me, you know what, Bert, you can't have both. It's either they're employees across the board or they're independent contractors across the board. And I got audited. I actually got audited by Texas Workforce Commission. And guess what? I passed. I passed the audit having independent contractors because I was able to prove to them, look, these are independent contractors because they do their own schedule, they see patients when they want to, and they have the autonomy to do all of that. Okay? It's just like hiring, you're like the general contractor in building a home, for example, right? You hire a plumber, you hire an electrician, you hire a carpenter, you hire a roofer, okay? You hire a foundation guy, you hire a painter. All of them are independent contractors, but you are the general contractor finishing the house. It's the same concept, okay? So talk to your CPA. If your state allows you to do independent contractor, good. If they don't, then go with a W-2 part-time employee. Here's the key. If you have an independent contractor, for example, a PTA, and you're paying the PTA $45 as an independent contractor, but they want taxes taken out, they want to move into the employee category or W-2 part-time, what you can do is ask your CPA, hey, Mr. CPA, I'm going to get this therapist in W-2 part-time. Is it okay to do that? If yes, then what you can do is adjust the rate. Instead of paying the PTA 45, you pay the PTA 40, because now the $5 difference you can use to pay for employer tax. Okay? It's totally almost the same. 40 for a W-2, 45 for an independent contractor. Depending on your accountant, it's almost the same. It kind of evens up. Does that make sense? Okay. But if I were you, you have to make sure that everybody's the same across the board. If you want to do part-time employee, have everyone part-time employee. If you want to do independent contractor, have everyone as independent contractors. Because now everything is uniform. That way you avoid the question of, wait a minute, if they're doing the same thing, how come one is a contractor? How come one is an employee? You avoid that question. All right. So you better get a good accountant. You better get a good CPA, and that will help you out. And it's a disclaimer, I'm not a CPA. I'm a physical therapist for about going 23 years now. I can teach you anything about the therapy side, but I'm just sharing with you my experience. All right. Anything else? All right, guys. So I'm probably only one of the few coaches online that gives you his phone number. If you have any questions for me, you can text me at 972-649-9909. Write it down. 972-649-9909. Send me your questions, or if you want to book a call, a free call, so I can talk to you, whether I can mentor you or not. You know, I'm thinking of starting a cohort with a 4 weeks program. I'm thinking of starting a cohort with a Tuesday group, a Thursday group, and a Friday group. What do I mean by that? If you're in a Tuesday group, we're going to meet 4 Tuesdays in a row. Thursday group, 4 Thursdays in a row, and Friday group, 4 Fridays in a row to discuss all of those modules. Okay? So in 4 weeks, you're going to be done. Okay? So if you want to be a part of this cohort, send me a text, 972-649-9909, and I can discuss with you how you can get in these groups. Okay, so for each group, I'm going to do a max of 5 to 10 therapists, 5 to 10 mentees. Okay? That way, it's just small and it's very interactive. Okay? So again, if you want to be a part of this cohort, or if you want to work with me one-on-one, send me a text, 972-649-9909. All right, I hope you guys learned something tonight. Is this good stuff or what? I hope you guys learn a lot, and I hope this opened your mind to a new kind of business model doing home health contracting. All right, again, welcome to 2021. Guys, don't give up, stay optimistic. Okay, even though there's furloughs and layoffs left and right, you can do something with your degree. You can do business if you really want to do it. All right, don't give up. Ask for help, ask questions, and I'm going to leave you with one of my favorite quotes tonight. Whether you think you can or you cannot, you're absolutely right. That's from Henry Ford. Whether you think you can or you cannot, you are absolutely right. I hope you think you can. All right? This is Bert De Vera, physical therapist here at Home Health Contract Show inside Alternative Healthcare Career Group. Good night.